So we begin the next lecture of our Forensicotomy series, and this next lecture, as the title displays, deals with asphyxia and the pressure to neck related deaths. So the first question that may arise in your minds after seeing the title should be that what is asphyxia? What does this term refer to? Asphyxia is a word commonly used to describe an interference in the transfer of oxygen from air to cells. I repeat, and it is a word commonly used to describe an interference in the transfer of oxygen from air to cells. In forensic medicine, asphyxia often describes a situation where there has been a physical obstruction in the conducting pathway of respiratory system. So we move to the next slide and see what we got there. The first slide is about introduction of this asphyxia. Asphyxia definition is a word commonly used for an interference in the transfer of oxygen from air to cells, tissues, and organs. Interference, what is the meaning of interference? Interference means hindrance or obstruction. Hindrance or obstruction in the transfer of oxygen from air to cells is called asphyxia. Now, interference or hindrance can be of two types. It can be complete interference or it can be incomplete. And the other term we use for incomplete is partial. So if there is complete interference of oxygen, this will eventually lead to anoxia. Anoxia means that there will be complete absence of oxygen in the body cells. And if there is partial interference in the transfer of oxygen, then this will lead to hypoxia. Yes, you have guessed it right. The next slide is about the classification and the types of asphyxia, and the main three categories in which we define asphyxia are mechanical, non-mechanical, and miscellaneous. In terms of forensic medicine goal, the money lies in mechanical, in understanding the mechanical asphyxia. Mechanical asphyxia can be of different types, for example, strangulation, hanging, choking, gagging, etc. There are numerous types of mechanical asphyxia, and we will discuss them in detail in coming slides, and some of those will be discussed in the coming lecture. Non-mechanical asphyxia. Now, how can an asphyxia be non-mechanical? If there is problem in the utilization of oxygen at the cellular level, and this can occur due to toxic substances, for example, carbon monoxide and cyanide. And the third and the last category in the classification of asphyxia is miscellaneous. Miscellaneous includes those types of asphyxia that can neither be classified as mechanical nor can be classified as non-mechanical. So miscellaneous includes, can you guess anything? Drowning, yes. Drowning is neither mechanical nor non-mechanical. Mechanical means that there is physical force applied in order to ensure asphyxia in the victim. And in the coming slide, we will discuss the pathophysiology and the science of asphyxia. Pathophysiology. Now, how does asphyxia affect the body, or what's its mechanism? So, in asphyxia, like we mentioned previously, there is interference in the transfer of oxygen from the air to cells. So if there is interference, then there will be decreased level of oxygen in the tissue, and there will be increased level of carbon dioxide. So if there is decrease in oxygen, then the cell will be forced to shift its energy yielding pathways from aerobic to anaerobic. And the main product of anaerobic respiration, we all know, is lactic acid. And lactic, since it's an acid, it will decrease pH. And when it decreases pH, the cellular proteins and organelles are undergo denaturation and coagulate. This leads to a certain type of necrosis called coagulative necrosis. And what are signs of asphyxia? Signs of asphyxia are cyanosis, congestion, edema, petechial hemorrhages, abnormal fluidity of the blood, and visceral congestion. I think what you only need to take this point from this slide, and the other points we will study in detail in the next slide. Now, what's the reason of this abnormal fluidity? What is the mechanism behind it? The abnormal fluidity is due to damage to blood vessel wall, which occurs in asphyxia, and this damage to blood vessel walls causes the release of fibrinolysin. Damage to blood vessel wall causes release of fibrinolysin, and it is this fibrinolysin that is the main reason of abnormal fluidity of the blood even after the death of the body. So it's a high yield post-mortem finding, autopsy finding in case of asphyxia. And let's move to the next slide to understand these remaining points. Vicious cycle of asphyxia. Once the asphyxia starts, there is interference in the oxygenation process, and the interference of oxygenation process leads to the release of local vasodilators in all the organs. So there is release of vasodilators, and these vasodilators cause the dilation of vessels. Vasodilators. So once the vessels get dilated, the vessels have more capacity to accumulate blood. So once they accumulate blood, there ensues the stasis of blood in those blood vessels. So once there is accumulation of blood, this leads to congestion. Congestion, if increases beyond a certain capacity, then the fluid from the blood vessel starts to leak in the interstitial compartment, and in this leakage ultimately leads to edema. And since there is a lot of fluid and blood accumulated in the blood vessels, the blood vessel wall eventually gets damaged, and RBCs get released into the tissue space, and this leads to fine hemorrhages called petechial hemorrhages. So I think almost all the points we have explained. Let's go to that previous slide and see what if we missed anything. Cyanosis we did miss. Okay, so how does cyanosis occur? Carbon dioxide, we know, gets accumulated and in asphyxia. So once the carbon dioxide gets accumulated, it's combined with Hb and forms HbCO2. And it is this HbCO2 that imparts blue hinge or bluish coloration to the skin and mucosal surfaces, which is called cyanosis. And how does congestion occurs? Like I previously explained, congestion occurs due to stasis of blood, and stasis of blood occurs due to engorgement of blood vessels, and vessels get engorged or vessels get dilated due to release of local vasodilators, and release of vasodilators occurs due to hypoxia. And the peak of congestion leads to the release of fluid from the blood vessel, which causes edema. RBCs also get released, and this release of RBCs and damage to blood vessel walls causes petechial hemorrhages, pinpoint hemorrhages called petechial hemorrhages. And how does visceral congestion occur? And it's the same mechanism of this congestion. Visceral congestion occurs by the engorgement of blood vessels due to release of local vasodilators, which causes accumulation of blood. And accumulation, once the blood gets accumulated in the viscera or the organs, and this is what we call the visceral congestion. So let's move on to this slide and see what's the vicious cycle. Vicious cycle means that once the oxygenation is disturbed, the capillaries get dilated. Dilated capillaries gets engorged with blood. Blood does not move because the capillaries are abnormally dilated, so there is stasis of blood. Once there is stasis of blood, the venous return cannot occur as effectively as before. And if the venous return is not effective, then venous return to the heart is not what it should be. So the right ventricle pumps lesser and lesser blood into the pulmonary circulation, and the lesser and lesser blood gets oxygenated, and this further worsens the asphyxia. This is the vicious cycle of asphyxia. It's not a very high yield cycle, and on the paper point of view, and I didn't see any MCQs in past papers of 10 doctors to have any point related to this cycle, but it was important in understanding the general signs. The first half of this cycle was important in understanding the general signs of asphyxia, which include congestion, cyanosis, edema, and petechial hemorrhages. So that's all about this slide, and let's move to the next one. Potential outcomes of pressure applied to neck. So what outcomes can occur one can expect if a certain pressure is applied to one's neck? The outcomes can easily be predicted if one understands or reviews the general anatomy. Having a general overview of the anatomy of neck can help us easily predict the general outcomes of pressure applied to neck. So what's the main thing in neck anatomy? It's the larynx and air pathways. That's major. That's the major thing that we are concerned in asphyxia is the air conducting pathways, and air conducting pathway in the neck is larynx. The other thing is jugular veins. That's a rough estimation that they could be expected, and the next thing is carotid arteries. So when the pressure is applied to neck or the side of neck, this may lead to obstruction of any of these three structures, either jugular veins or carotids or the larynx, and the compression of any of these leads to different outcomes. So let's go to next slide and see what outcomes can be expected if if any one of these is compressed. So jugular veins, if compressed, get obstructed, and once they get obstructed, since their duty is to transfer of deoxygenated from the head and neck to the trunk, so there is impaired venous return from the head, and the head gets accumulated in the head, and so the blood gets accumulated in the head, which leads to congestion and petechiae and cyanosis, because there will be accumulation of carbon dioxide. Carbon dioxide will combine with Hb, forming HbCO2, and this HbCO2 will impart bluish hinge or bluish color to the skin and mucosal surfaces, which is called cyanosis. The next thing is obstruction of carotid arteries. And do you notice something? Why did I bother mention if severe? If severe is mentioned because carotids do not normally get obstructed while applying pressure to neck. The reason is that the jugular veins are more superficial and their walls are much less thicker than the carotids. Carotids, like all the arteries, have strong muscular walls, and having strong muscular walls means that their patency is maintained even at a high pressure. So in most of the cases of pressure applied to neck, the carotids are not easily obstructed, and if they get obstructed, then since their duty is to provide oxygenated blood to the viscera of the head and neck, so if their duty fails, and cerebral hypoxia occurs, and since we know that the neurons are the most sensitive tissue of the body, most sensitive to hypoxia, so within seconds the person gets collapsed. The next thing is the stimulation of carotid sinus baroreceptors, and their stimulation occurs by applying pressure to the neck. Once these baroreceptors get activated, they send impulses via glossopharyngeal to the nucleus tractus solitarius and the vagal nuclei, and the job of the vagal nuclei is to cause bradycardia and eventually asystole. And this bradycardia and eventually asystole, this duty of vagus is called vagal inhibition. The last structure of the neck that we discussed regarding the asphyxia was larynx, and elevation of the larynx and tongue as a result of applying pressure to the neck closes the airway at the level of pharynx. And it is high yield to note that the cartilaginous trachea is more resistant to compression unless severe force is applied to the neck. I repeat, the cartilaginous trachea is more resistant to compression unless severe force is applied to the neck. And in the next slide, we will have a general overview of the subtypes of mechanical asphyxia. And we know that since I previously mentioned, the money lies in understanding the mechanical asphyxia. It is the most high yield of all the other types of asphyxia from the forensic point of view. Now, the major subtypes, it has two major subtypes. Mechanical asphyxia can be divided into two major subtypes: strangulation. Strangulation includes things such as hanging, lynching, garroting, throttling, Benzdova, etc. And we will study strangulation in the next lecture. And here we are going to discuss the non-strangulation related mechanical asphyxia. Non-strangulation related mechanical asphyxia, and these include things such as smothering, traumatic asphyxia, burking, gagging, choking, and autoerotic asphyxia. Don't worry much about these slides. We are going to study them in detail in upcoming slides. What you should take home from this slide is that is the definition of first two bullet points. Smothering. Smothering is closing of nose and mouth by mechanical means. Smothering is closing of nose and mouth by mechanical means, and traumatic asphyxia is immobilization of chest. Traumatic asphyxia is immobilization of chest. Smothering is closing of nose and mouth by mechanical means. Now we go ahead.